Hello, my name is Udim Damachi. I am a PhD student at the University of Maryland, Baltimore, in the Department of Pharmaceutical Health Service Research. I was awarded the 2024 PhRMA Foundation Predoctoral Fellowship in Value Assessment and Health Outcomes Research. My interest in research or in the medical sciences, I'll say, started at an early age. And this was largely inspired by my father, who was a medical doctor. I decided to go to pharmacy school. So during this time in pharmacy school, I'll say that was where I got exposed, my first exposure to research. After graduation, after becoming a medical sales representative for a pharmaceutical company, I got to interact a lot with pharmacists and medical doctors. And I realized that a common theme or a common question they always asked me was, how much are your medications? Are they safe? Are they effective? What research has been conducted to show that these medications are cost effective? And then with that, I always had to look for articles or research that has been conducted to show that my medications worked. So during that time, I really enjoyed just reading the articles, learning more about the methods. I just became really curious to learn more about how this research was being conducted. And then I decided to apply for a master's degree in health outcomes research. And I can tell you the rest is history. My PhRMA Foundation funded research project aims to examine whether antihypertensive medications can be used to prevent heart failure in breast cancer patients receiving anthracycline treatment. So anthracycline is a chemotherapeutic agent that is used in breast cancer patients. And although anthracyclines have been very effective in improving survival in breast cancer patients, anthracycline can cause severe short and long-term heart failure, particularly in women with pre-existing heart disease. To protect the heart, guidelines have recommended the use of the antihypertensive medications in women taking or receiving anthracycline treatment. The evidence has been conflicting, given that some of the clinical trials that have been conducted have found benefits while others haven't found any benefits. I aim to use real-world data and methodologies that have been used to account for the observational nature of my study to investigate whether antihypertensives can actually prevent heart failure in early breast cancer patients receiving anthracycline treatment. I aim to answer three important questions. First of all, what are the risk factors that can increase the risk of heart failure in patients receiving anthracycline? Secondly, I aim to identify the patients who will likely benefit from the use of these medications. And then finally, I would like to also compare antihypertensive classes to see whether one is superior to the other. This will help clinicians make informed decisions in deciding whether one antihypertensive class will be beneficial compared to another antihypertensive class. Receiving the PhRMA Foundation Award, I'll say, has been the highlight of my PhD journey. Knowing that my work is significantly valued has boosted my confidence as a researcher. It never goes as planned, because usually it never ever goes as planned. So sometimes you have like perfect idea in your head, you put it down on paper, and then you go into the data. What you're seeing is what you never expected. Over time, I feel like as a researcher, you learn how to deal with it. You always have to learn, have a backup plan if things don't go as planned. Don't be scared of failure, because I feel like a lot of us get scared of failure and then you end up not trying. All we want to do is win. I want to win. I want to get this grant. I want to get my paper published. But at the end of the day, life is a process. Research is a process. My overall goal is to be able to impact policy change. I want to conduct research that can shape policy and ensure that the approved medications are safe and effective for use in the general population.